Hi, Gary Hoffman. I'm a surgeon with Los Angeles Colon and Rectal Surgical Associates in Beverly Hills, California, and a surgeon at Cedars-Sinai Medical Center in Los Angeles. I want to talk to you about something today that you may think about, hear about, or read about, but don't think it can happen to you, and that's anal cancer. Anal cancer can strike anybody, and it does strike 5,000 people per year. It doesn't matter who you are, what your orientation is, how tall you are, how fat you are, how well you eat, or what you don't eat. It can strike everybody. And we want to know how to diagnose it once we think there's a suspicion. And I've talked about the diagnosis of anal cancer. A finger exam, a digital exam where the surgeon or your doctor puts a finger in your rectum and can feel it, a colonoscopy, or other things. It's diagnosable. And that's what I want to talk to you about now. And the first thing I want you to diagnose is your own fear and your own worry. Not every change in your bowel habits means you have cancer, and the same is true for anal cancer. But suppose you are worried and you're able to overcome your fear and go to your doctor. What can we do? I'll put a finger in your rectum. It doesn't hurt, it feels a little bit funny, but it's over very quickly. And I should be able to know because the anal canal is very short, shorter than the length of my finger, whether you've got anything up there to worry about. I can put a colonoscope in, and with you sedated, I can put in a lighted tube with a camera. That's a colonoscope, and I can see what's there. I can take pictures, I can do biopsies, and I can determine whether you have anal cancer or not. There are other tests that we use for colon and rectal cancer, but they're not quite as good. There's a barium enema, which is an x-ray where a radiologist puts barium in your rectum. The problem is the way the setup is configured, the installation of that barium may actually occur above the level of the anal cancer, and it would entirely miss the anal cancer. A virtual colonoscopy is better because it can see the entire rectum and anal canal, and an MRI can do the same thing. The only problem is it can't do a biopsy. So the gold standard after the finger test is the colonoscopy, and by the time that's been done, we should have a good idea of what we can do to diagnose you and treat you. But remember what I said in the beginning. Step one, conquer your fear. I'd advise you not to do a lot of reading about it because it'll scare you, but it should also promote you. It should push you into going to see the doctor and see the doctor immediately. You're not immune because you're in the wrong group to get anal cancer. There is no wrong group. Everybody can get it. 5,000 of us will get it, and hopefully most of us will be curable. This is Dr. Gary Hoffman with Los Angeles Colon and Rectal Surgical Associates, trying to throw you a life preserver. You do the rest. Go get tested.